Dear friends, I am once again happy to see you on this Saturday. It's a great day for me. Today is the 14th Saturday, December 2024. We have finished 1503rd case of Puberphonia. Happily, they are going on having a great life for them. So our treatment give a good energy for us that we are doing a great work on voice. And every day we are getting good news regarding our progress, how to go ahead, how we are making it as a successful venture. Today, I'm having a great idea to say the world to prove EULA is not only an accessory organ for speech, it is a great organ to produce a low pitch voice. So I have given the name. I propose a theory called as Euler source phonation voice filter theory. It is a valve filter theory to treat puberphonia. So Euler region in the respiratory tract is gaining more important. I am proposing a theory. So a phonation valve filter theory to treat puberphonia. Yes, this valve filter, which is to convert the aerodynamic into acoustic as a prime source of treating puberphonia. So it is a mental filtering, a selective absorption, a type of cognitive distortion. So it filters out only the positive ones. So it removes the negative aspect of the situation. That is why it is called as filter. So all the negative thoughts are removed. So everybody should try to understand Euler phonation. It acts as a wall filter theory. What is the importance of the filter? The filter increases performance. So more airflow. So more energy is created. So better performance and improved performance. Already we have learned that pharynx is having two valves. It acts for food and air. Pharyngeal muscles and valve are involved in phonation or the production of the sound through the larynx. I am more concentrating and on valvopharyngeal valve. Valvopharyngeal valve is made up of soft palate, lateral pharyngeal valve, posterior pharyngeal valve. It closes to direct the sound and air into the mouth and is necessary for most speech sounds. So, valvopharyngeal valve is a very essential one in our speech mechanism. No doubt, I am not different from other valves available. Yes, the primary valve is for speech is definitely larynx. Larynx is already described clearly that it is a complex organ located in the upper airway and contain the vocal fold. When air is forced through the vocal fold, they vibrate and produce sound. Similarly, pharyngeal muscles also involved in phonation, breathing, swallowing, and maintain the caliber and patency of the airway. Modern days, they are more mentioned about epiglottopharyngeal valve and arytenoid valve. These are the two valves. They have given lot of interest because ventricular band, false vocal cord is partially covered just above the vocal cord and it is acting as a valve. Epiglottis also act as a one-way valve to prevent food from entering the trachea during swallowing. Here we are more concentrating on soft palate, which is called as velum. This velum, this valve prevents food from entering into the nose during swallowing. So, in what way it will help in speech means valvopharyngeal valve. This valve is made up of soft palate, the side and back of the throat, and the pharynx. Valvopharyngeal valve separate the oral and nasal cavity during speech and swallowing. All these pharyngeal valves are created by contracting several muscles, including the levator palatin, muscularis uvulae, superior pharyngeal constrictor, palatopharyngeus, palatoglossus, and salpingopharyngeus. So these are the muscles involved in valvopharyngeal valve. A healthy pharynx is important for respiratory and phonatory function. So we have to keep our pharynx healthy, avoid smoking and taking prevent infection. So here I want to go deep into the importance of these valves little more because this is going to solve our problem and prove to the society that uvula is a phonatory organ. I'm just going on telling them all. There appears to be a swing type of one-way valve in the pharynx. The short palate hangs from the hot palate like a peninsula in the airway, similar to the epiglottis, while the soft palate function as an expiratory valve. In fact, both the epiglottis and soft palate function as valve to prevent the food from entering the trachea, nose, and nose during swallowing. So it is already documented the possibility of expiratory obstruction during a positive pressure intranasal ventilation is caused by the valve-like behavior of the soft palates. So our endoscopic study by our research group confirmed that expiratory obstruction of the soft palate causes an expiratory flow limitation in agreement with other structures. So this is a very important thing we want to discuss, because so far lot of treatment available, good treatment available for puberphonia. The voice therapy is the primary treatment of puberphonia. That puberphonia means that voice disorder that occur during puberty. The first treatment is glottal attack. And nobody glottal attack. You have to do glottal attack. Second thing is make vegetative sound. Use sounds like coughing and throat cleaning and start voicing. That is the treatment for puberphonia. The third thing is make glottal fray. Produce the lowest possible pitch. How to do? Nobody explained clearly. Digital thyroid manipulation. Gently push the front of the thyroid cartilage while sustaining a vowel. These are the things we can do. Then speech range masking. Speech while a loud voice is playing and then listen to the recording of your voice. The last one, they have included our uvula manipulation and resonance to treat puberphonia by Google. This is a great thing, achievement for us. Uvula manipulation and resonance, our practice of treating puberphonia is included as one of the treatment for puberphonia. So this is not only just changing the voice, practice a forcible airflow from the stomach. That one has to get trained in our method. How to practice airflow from the stomach while talking. And at the level of the soft palate and the uvula, we have to change the high frequency to low frequency, and should be resonated in the nose and delivered through the mouth. Very big matter, but we can do it very clearly, easily, provided we train. So this I have to discuss a lot. Phonation means, they say, the creation of sound at the level of the vocal cord. This is what everybody explained. Phonation is created at the level of the vocal cord. Because I never want to contradict to the statement. Yes, correct. But the process of phonation involves converting aerodynamic energy into acoustic energy through the opening and closing of any structure in the vocal tract. Please try to understand. Any structure in the vocal tract where opening and closing occur, that produce sound, where the phonation involves in converting aerodynamic energy into acoustic energy. It clearly reflects that oropharyngeal, pharyngeal, and closure, that is a valve, and nasopharyngeal, valvopharyngeal sphincter valve. It acts as a valve along with the vibration, that is the trill made by the uvula, create a very good low pitch voice. So we are able to conclude and come to the inference that uvula manipulation and resonance treat puberphonia. Nowadays we have found a good response, not only a response, good idea and good support by many Korean and Japan ENT surgeons. In Korea, a great speech science laboratory is there. So they almost feel that their idea is very similar to our treatment. So they have studied the structure of the supralaryngeal structures. They decided and created an artificial phonatory apparatus and divided this into three: normal pharynx. What happened during normal speech production? Second is antero-posterior narrowing of the pharynx at the level of the tongue root and meeting of the posterior pharyngeal wall. This is very, very, very interesting. Narrowing of the pharynx at the level of the tongue root, where the tongue, uvula, and posterior pharyngeal wall meets. This is the possible way of singing in opera style. With open mouth, they vibrate the uvula with the anterior to posterior narrowing of the pharynx, which happens at the level of the tongue and posterior pharyngeal wall. So this is called opera style of singing, where it is a low pitch, open stage music entertainment. The third one is lateral to medial narrowing of the pharynx, which is popularly a style of singing in twang style singing. So these two singing theories help us to a great extent to say that we are in the wrong, correct position, and we are supported by the good type of phonation because of the valves in the throat and their functioning in tone and voice production. Definitely, we know the larynx is very important. See, what happened is my theory high pitch is at the level of vocal cord and low pitch is at the level of valopharyngeal isthmus. That means it is at the level of uvular region. Very good and happy. So this we should prove by some mathematical calculation. We are aiming very soon we'll be able to prove it, and so now everybody accepts that phonation also happen in extra laryngeal region. So olden days there was a feeling only vocal cord can produce phonation. That is why the definition means it is a vibration produced by the vocal cord. No doubt other structures are important. They have told it is only modulating the voice. And everybody is having good impression. As far as phonation is concerned, it includes the lung and respiratory muscle, trachea, and the larynx. They stop with that. They have given a lot of importance only to the vocal cord, not even a little importance to the pharynx. So nowadays, we are bringing out a good positive response by seeing the articles of Taiwan, Indonesia, and Japan. So they have given lot of inference that not only the vocal cord can produce sound, the supralaryngeal structures also produce good amount of sound. Now also they have come to a conclusion. Puberphonia is a very common problem and needs immediate treatment. Yes, it needs immediate treatment in boys. For treating puberphonia, we diagnose it. Only voice pitch assessment is the only test required mostly. No other test required in puberphonia. Third important thing is a redirected phonation treat puberphonia. because no surgery, no medicine is given in puberphonia treatment. What is the voice they get means they get the ancestral voice. Puberphonia treatment is not immediate, not one day, because even coughing can produce high pitch to low pitch. How to maintain it? We employ group training to enhance that success. Voice with a high pitch voice have a increased chance of homosexual activity. They will be happy because they are hearing their nasopharyngeal cavity resonance voice in the post-operative period of treating puberphonia. So this is a great achievement that uvula is an accessory organ of speech. After treatment, the required boys are very grateful to the treated doctor. Nowadays, more few medical fraternity people are telling about diplophonia and diphthongia. That two sounds of different pitches in right vocal cord and left vocal cord. They say like that, happy. But we found one voice is from pharyngeal and another voice is from laryngeal voice. That we have to prove in diplophonia. The whole region is entirely different. Originally, they thought in diplophonia, two voices. One is made by one vocal cord and another is made by another vocal cord. We have found that one voice is pharyngeal and another voice is laryngeal voice. Diplophonia. So to say, the great Tamil actor M.R. Radha, he is having diplophonia. Everybody appreciate him. The old theory was one voice is produced by one vocal cord and another voice is produced by the another vocal cord. Now we have found that one voice is a pharyngeal voice and another voice is a laryngeal voice. Another thing, very important thing is in voiced sound, the vocal cord produce sound. In voiceless sound, the uvula modulated the airflow, but we say the uvula produce sound. So these are the new finding we face when we treat puberphonia, and we are able to successfully treat 1,503 cases of puberphonia. That means it is not one day work, it is 30 years of work. Still, we have to do a lot of work regarding the treatment of puberphonia. What are the things happen? We have to tell the public, that only the medical fraternity will have more idea that what we are doing and what other things happen in the treatment of puberphonia. So today we have discussed about oropharyngeal, that is a pharyngeal wall, and nasopharyngeal wall. So these two are very important structures where the aerodynamic energy is converted into phonatory energy. That is called voicing. That is called phonation. So anywhere in the supravocal tract or vocal cord level, phonation can be produced. What you need is a valve or a stricture or a narrow place and vibration also. Luckily, already in the larynx, narrow place is there, glottis, and vibrating structure is there, vocal cord. So that is believed where phonation occur. Now, extra laryngeal phonation also places are there. The important good narrow place is valopharyngeal isthmus and the meeting place of pharynx and oral cavity, where the vibration or trill is produced by the uvula. So, a good place for second phonation. So, with this great finding, we are going ahead with our work. So, thank you very much for this Saturday, 14th December 2024. We have finished 1,503 cases of puberphonia. So, happy to meet next Saturday with more number of cases. Thank you. Great, 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 great.